you have hay fever, you might have itchy, runny or watery eyes, you might be sneezing a lot or even have a blocked nose, or you might have an itchy throat. These are all signs of hay fever because they are allergic reactions to things like pollen that's in the air. So you can actually check the weather to see if there is a high pollen count, to see if you are more likely to get these signs of hay fever. So what can you do to help with these hay fever symptoms? You can use a nasal spray. So nasal sprays tend to have a steroid in them. And these include beclomethasone or fluticasone or mometasone. And these steroids help to reduce any activity of these cells in your nose that are likely to give you those signs of hay fever allergy, including a runny nose or a blocked nose. With steroid nasal sprays, they can also help to reduce symptoms around the eyes, so they can help reduce any itchy or runny eyes. And they might also help to reduce any symptoms in your throat, so to reduce having an itchy or scratchy throat. With steroid nasal sprays, you need to use them every day and you need to keep using them for them to continue to keep working. Ideally, you will start using a steroid nasal spray around 1 to 2 weeks before you start to get any signs or symptoms of hay fever. But if hay fever season has already started, then you should just start using the nasal spray and then expect to get relief from your hay fever signs and symptoms in about 1 to 2 weeks, as it can take some time for the steroid medicine to actually start working in your nasal area and to reduce the inflammation and reduce the activity of these cells that produce all of the allergy reactions. You can also use eye drops, and eye drops will help to reduce any redness and reduce any runniness in the eyes, and they usually contain either an antihistamine or they will contain something that helps to stop the cells in your eye from producing lots of fluid. You can also take tablets, and tablets which can help with hay fever signs and symptoms include fexofenadine, cetirizine, loratadine, chlorphenamine and acrivestin. So depending on how many times per day you need to take an antihistamine, antihistamines help with all signs of hay fever. So you need to start taking them once a day. This is normally true for fexofenadine or cetirizine or loratadine. And for the other antihistamines, acrivestin and chlorphenamine, you might need to take them more than once per day because they are broken down more quickly by your body. So when you take them after a few hours, you might start to feel your hay fever signs and symptoms come back. And so you need to take another tablet. When you take antihistamine tablets, you might start to feel a bit dehydrated. So you may need to drink a bit more water than usual. And also some antihistamine tablets or antihistamine liquid can make you feel quite sleepy. So keep that in mind when you are choosing which antihistamine you want to use to help with your hay fever signs and symptoms. When you're taking any medicines, please speak to your pharmacist or doctor to make sure that it's the right medicine for you, and talk about any other medicines that you might be taking, and let them know if you have any other health conditions or if you are pregnant or trying for a baby. Thank you for watching.